Jalaluddin.
Representatives from the Australian High Commission, the President of the General Surgeons Australia, Mr. Trevor, the President of the Pacific Island Surgeons Association, Lord Tangi, dignitaries, invited and distinguished guests, sponsors, supporters, partners and friends, ladies and gentlemen, Nisambula Vinaka, and a very good morning to you, and of course, welcome once again to Fiji. My deepest gratitude for the kind words of welcome, MS, and the solemn Fijian traditional ceremony of welcome delivered and accorded by the surgeons of the Pacific here this morning. I'm deeply honored to be invited to officiate at this opening ceremony, and I thank the organizers for giving me the opportunity to be part of this very, very auspicious event. Ladies and gentlemen, as mentioned, today marks the beginning of a unique event in the history of surgical services in the region, where two distinguished professional surgical organizations in our regions, the General Surgeons Australia and the Pacific Island Surgeons Organization, come together to hold this combined scientific conference in Nadi. This unique collaboration is beautifully exemplified by the traditional welcome this morning, in which our much loved and respected traditional Fijian ceremony of welcome has been performed by the men and women of surgery in the Pacific, the highest honor we accord to welcome distinguished guests visiting our shores. I commend the spirit of collaboration and support the display today, and I hope this will all go very well for our future collaborations. Ladies and gentlemen, I'd firstly like to acknowledge and commend the work that General Surgeons Australia has done for surgical services in the region. I have been informed that the General Surgeons Australia was founded in 1999 as the professional association that looks after the welfare of general surgeons in Australia, and in 2009 assumed the responsibility for surgical education and training programs in general surgery to the level of fellowship for the Royal Australasian College of Surgeons. The progress and achievement of the General Surgeons Australia as a premier professional organization for general surgeons in our region speaks for itself and is worthy of praise. Over the years, the GSA has looked beyond its borders and paid particular attention to the Pacific, supporting the development and strengthening of surgical services in many of our island states. In doing this, the members of GSA have developed a close working relationship with the Pacific Island Surgeons Association, as well as individual surgeon fraternities and surgical departments in our countries. The General Surgeons Australia has also developed its relationship with the New Zealand Association of General Surgeons and the Association of Surgeons of Great Britain and Ireland. Ladies and gentlemen, the GSA has allowed many of its members to travel and serve in the Pacific, as well as allow Pacific Island surgeons to come to Australia to work and learn from your centers of excellence. This is indeed a tremendous show of support and goodwill. I have personally met some members of your association who have come to volunteer their expertise in Fiji in the recent past, and have found them to be very approachable, compassionate to our cause, and highly skilled in their work. On behalf of the Fijian government, ladies and gentlemen, I'd like to commend and deeply appreciate the work done by the General Surgeons Association of Australia. Ladies and gentlemen, coming back to the Pacific Island Surgeons Association, I'd also like to acknowledge and commend the Pacific Island Surgeons Association for the work it is doing in our Pacific, for the Pacific Island surgeons, and for the provision of surgical services in our countries. I'm informed that the PISA started from humble beginnings in 2003 in the Cook Islands and has grown in strength and status in the last decade. The membership now comprises surgeons from Tonga, Samoa, Cook Islands, Papua New Guinea, Solomon Islands, Federated States of Micronesia, Marshall Islands, Tuvalu, Kiribati, Vanuatu, and of course Fiji. And the purpose of the association is to represent and promote the practice of surgery and work of Pacific surgeons in our region. I also understand that Timor-Leste surgeons who trained in Pacific are keen to be part of this mix, and this is also commended. Ladies and gentlemen, the Pacific Island Surgeons Association, surgeons from the Pacific who are surgically trained in our own universities in Fiji and Papua New Guinea, as well as those trained in Australia and New Zealand, have toiled hard over many, many years to deliver expert surgical services for our people against many challenges that are peculiar to our region in the world. Your dedication and efforts is truly commendable. Ladies and gentlemen, PISA has also developed a strong working relationship with GSA members and with the Royal Australasian College of Surgeons. A product of this collaboration has been the RAC of Surgeons Pacific Island program, which was established to support, one, the provision of specialist surgical and medical services in the Pacific, and of course to assist in the education and training of our clinical practitioners in the Pacific. This program has been very successful to date, with many members of our communities benefiting from the skilled surgical services provided, and many surgeons, anesthetics, nurses, allied health workers in 11 Pacific Island countries trained and upskilled. I believe it is correct to say here that at this point in time, we have more qualified Pacific surgeons working and serving in the Pacific region for the Pacific people than we ever had. I salute the vision and dedication behind this effort. Thank you very much. Ladies and gentlemen, coming back to your conference, for this combined conference, I'm very much pleased to note that there is representations from many countries in our region. I'd also like to welcome all the conference delegates from Australia, Federated States of Micronesia, Kiribati, Marshall Islands, Nauru, New Zealand, Papua New Guinea, Samoa, Singapore, Solomon Islands, Switzerland, I believe, Timor-Leste, Tonga, Tuvalu, United States of America, United Kingdom, Vanuatu, and not forgetting our own Fijian surgeons. Ladies and gentlemen, it is incredible to have the presence of world-renowned surgeons and surgical specialists intermingling with surgical trainees and trainers, sharing your vast wealth of knowledge, experience, expertise, and developing lifelong professional networks. I also note the three leading global health expertise, Dr. Stephen, Dr. Kelly, and Dr. Walter, will be part of this forum as keynote speakers. Their contribution, I'm sure, will certainly add more value to this already rich forum, where you will discuss on what is latest, what is appropriate, and what is achievable for our region and the world now and for the near future. Ladies and gentlemen, the overall expected attendance across the 4 days is anticipated to exceed conveners and organizers' expectation, and I'm certain that the resolutions at the end of this forum will reflect your considered thoughts and deepest wisdom in charting the way forward on how surgery and surgical services should be delivered to the people of our region. At this point, I'd also like to mention a few critical issues. Shortage of surgeons, ladies and gentlemen. One of the critical issues we face in the Pacific region is the shortage of qualified surgeons. The published survey conducted in 2017 by researchers and surgeons from your two organizations collaborating on the 6 global surgery matrices that were proposed by the Lancet Commission on Global Surgery and adopted by WHO and the World Bank revealed that while the perioperative mortality rate was low, ranging from 0.11% to 1%, only 5 of the 13 countries surveyed met the target of 5,000 surgical procedures per 100,000 population. 4 of the 13 countries had 20 or more surgeons. The report also noted that 5 of the 13 countries had more than 80% of their population accessible within 2 hours of emergency surgical processes. It is thus critically important to have trained and competent surgeons working in the Pacific. The qualified surgeon is the critical pivot around which surgical services can be developed and enhanced. In other words, it is very difficult to build sustainable quality surgical services without a qualified surgeon championing the cause. Ladies and gentlemen, also many Australians do visit and work in our islands, and it is equally important that they receive quality surgical service when they need them. Whether through initiatives to accredit training positions or the formalization of work placement or other innovative arrangements, it is hoped that the deliberations of this forum will indeed lead to enhanced support towards training of surgeons and related health staff and expertise in the region. Ladies and gentlemen, our region is prone to natural disasters. Our recent history has shown us how many of our countries have been devastated with cyclones, tsunamis, drought, and severe adverse weather conditions, the effects of which are impacting food security, emergence and re-emergence of communicable diseases, and the loss of our heritage and property that directly impacts our people's health and well-being. Our Prime Minister, as the President of COP23, has led the global fight to encourage and convince world leaders to agree to the sustainable reduction of carbon emissions that will lead to the reversal in the negative impact of global warming. We also have a role to respond to our population when disasters strike. Surgeons, as lead caregivers in our health services, play a critical role in emergency response efforts during disasters. I also hope your deliberations will result in greater focus on how your two organizations can contribute towards better organization, coordination, and delivery of emergency responses in our region and beyond when we are faced with aftermaths of natural disasters. Ladies and gentlemen, I cannot conclude this talk without mentioning NCDs, the NCD crisis that currently engulfs our region. NCDs is on the rampage in the Pacific, and it will require all hands on deck to check its progress. NCDs is the #1 assassin that maims and kills our communities. In Fiji and the Pacific, diabetes and its complication contributes the most to the workload that our surgeons and clinicians face in their workplace. The Pacific region needs its surgeons to be an integral part of the solution, not only through the expert clinical services that halts the progression of NCD and its complication for sufferers, but also as advocates for wellness and health living so that NCDs are prevented in the first place. Surgeons need to be in the forefront of teaching and living health lifestyles, avoiding risk factors of NCDs such as obesity and physical inactivity, and leading health initiatives in our health services in the community that promote healthy diets, that promotes exercises and reduce smoking and alcohol consumption, to name some of you. I'm sure these will be some of the issues that will be part of your deliberations during the forum. Finally, ladies and gentlemen, once again I'd like to acknowledge the tremendous support of Australia and New Zealand governments through Australian Aid Program and New Zealand Aid Program, respectively for bringing delegates to here in and around Nadi for this conference. The two programs, through their funding support of REX and SPC and the Pacific Island Surgeons Association, have ensured that surgical delegates from the whole region are able to attend this 4-day session of the conference, of course including the pre-conference and the post-conference sessions and courses for trainees. The GSA has sponsored at least 26 regional surgeons to attend this meeting, and I thank you for all that. To all the supporters, partners and donors and supporters of surgical services in the Pacific, I say thank you very much and Vinakapakaleu for your support. Ladies and gentlemen, finally I wish you all the very best for a very fruitful deliberation over the next 4 days, and I also look forward to learning of the outcomes of your discussions. Please do take time to enjoy what Fiji has to offer in terms of hospitality and of course our food. And do re-energize before returning to your busy work schedules back home. And I normally say this, should you go overboard with our hospitality, too much drinking and eating, take a dip in our beautiful seas or the pool, burn off those extra calories because we want you to be safe as well. So with these words, ladies and gentlemen, thank you once again, and I'm pleased to declare the combined GSA and PISA conference open. Thank you very much, and God bless.